2022 meeting of the Health and Human Services Committee to order. Will you please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Yeah, go ahead.
We have a call-in user 9206 ending in 84. Can you identify yourself, please?
Kim Weber with McDevco.
Thank you.
All right, item number 3, public comment. I don't believe that there's anybody who wishes to address the board. Did the clerk have any? No? Okay. Item number 4 then, public hearing for community development block grant. 4A, status of the community development block grant project, including an overview on the project activities completed to date and activities remaining to be completed. Vicki, I believe?
I'll kick us off,
Go
and
ahead.
then Vicki will have all the important information and more detail. So just really quickly to kind of ground us all in kind of why we're here today. As the pandemic was something that the county had to respond to in 2020, the board directed, 2021, I believe, county board directed staff to apply for these funds, these community development block grant funds that were related to pandemic response, to essentially address community pandemic impacts. And one way that we did that was applying for these funds. And just again, a little bit of background, the funds are for areas outside of the city of Wausau. And you might ask why. Very good question. The reason is that the city of Wausau, that metropolitan area, does receive community development block grant funds directly from the state and federal government already. So this was a mechanism through the pandemic response for those funds to be deployed outside of that already existing area. So the county board directed staff to do something. I then directed Vicki to find out how to do that. So Vicki led our grant application process. She also then is overseeing the sub-allocation of the specific funds to both McDevco and to North Central Community Action Program. And again, those funds that we applied for were to address 2 primary community impacts. The first related to the disproportionate impact on small businesses, and the second related to individuals that were impacted in terms of housing through the pandemic. So with that, I'll have Vicki provide the overview that is required based on our receipt, of these grant funds.
Thank you. So to date, we have spent $202,000, $154.80. So I have these numbers too for Kim for the minutes if you want, so in case I am not as clear, but over $200,000 total. And the project itself was put forward as up to $500,000 for McDevco to support small businesses that had a negative effect during the pandemic, and then $500 for North Central CAP to assist with mortgage assistance or rent for individuals that had concerns and inability to pay those costs during the pandemic. So those were our 2 partners, as Lance had said. The micro enterprise or the small businesses through McDevco to date, $175,000 has been requested and distributed, and that is for 35 businesses. And then in terms of housing assistance, the amount is $11,578, and administrative funds, $15,576 for the total of $202,154. The grant ends on 5/31/23, so we have less than a year left. And our early prognosis here or projection here is that our entities may not spend all of the money. during this time because of the requirements and provisions that are placed on in terms of eligibility. And the further we get out from the height of the pandemic in terms of people being able to show an actual loss, the less likely they may be able to apply successfully for these funds, especially in the area of housing. So that may occur that a full amount of the grant is not earned, basically. So that's the overall big picture. One of the things that we are required to share is that there has been no negative impacts from receiving this grant, no negative repercussions from anybody receiving, so there's no mitigation services that we have to put in place, which would have been required had that applied. So that is not the case. With that, that's really, we have our two partners from McDevco with us, one on WebEx and one in person. If there were any other details that anyone wished to have.
Are there any questions? Go ahead, Supervisor Covelli.
Thank you, Madam Chair. You said that McDevco received $500,000, is that correct?
That's the amount of the grant that they could apply for, up to that much money. That's how it was basically split out. But they have to basically incur the costs first. So by people applying for it and then being approved, they could spend, again, up to that $500,000.
Okay, so right now you said that they've spent up to $175,000 of that?
Correct, correct.
Okay. And I know Kim is on the line, correct? And maybe she can answer some of this. And I believe you said there were 35 recipients of that. Are there any more applications coming in at the time?
Kim, are you able to answer that?
Yep. Can you guys hear me? Yes, I believe, Vicki, does that number include the last batch that we just submitted to you?
This would, I think, have been through June.
Okay. Yep. So I believe we just submitted a batch, and Yvonne might be able to give the specifics on that, of folks. I believe we submit in groups of 5. So once we have 5 applications, we then submit. So we are current at this point in time with what we've submitted.
Okay, thank you. Do you expect any more to come in before the deadline?
We do expect more to come in before I believe it's March 2023 deadline, yeah.
Okay, thank you.
Okay, are there any other questions? Go ahead, Supervisor Leahy. Sorry.
Thank you, Madam Chair. Just wondering if there's anything the county can do or should be doing to help get the word out that there are still grant funds available, or are there other partners that we could be working with? Thank you.
So I will let you know that both North Central Cap and McDevco have advertised this in their own ways with their constituents and partners, and I believe they have information on their websites and where they make connections. So they've done what they can do, and as people come in and apply for any type of assistance, they are determining at that point, might they be eligible for this? So that would be my high level.
This is Administrator Leonard, and then Kim, I would welcome you if you want to add any additional details. I think it's important to also recognize that there's a lot of other resources that individuals that McDevco will have contact with about this grant that perhaps are getting those needs fulfilled in some other form or fashion. You may recall there were the PPP loans that were provided that ultimately, for a great many businesses, became forgivable loans. There were, even locally, the Community Foundation and working with McDevco had other avenues available to business owners. The reality of this system, and I don't know, Kim, if you want to talk about it at all, there are certainly limitations on who can access these funds that for some businesses may lead them to decide not to do so. But it is a benefit that the board asked staff to again apply for and sub-allocate to McDevco and to North Central Cap. I think certainly for the businesses that have determined it was in their best interest to take advantage, it has served them well. But I don't know, Kim, if you want to talk a little bit about any of the additional advertising or potentially the other programs that are available to people. I will say one thing the county has done. We did advertise it in some of our communications, and we talk about it frequently with our municipal partners. I know Kim, through McDevco, Kim with Yvonne, set up our municipality meeting call. We have made this very much a topic of communication with our municipal partners that have economic development work that they do. But other than that, I'll certainly defer to Kim.
Yeah, absolutely. And Yvonne might have some insight too. So we're both here to share. I think, you know, from an advertising perspective, I know we leverage MailChimp. It's readily available on our website, pardon me. And to Lance's point, the municipality meetings, you know, we just had one and shared with the municipalities that were outside of Wausau, like, hey, this is available. Take some information with you. And have had a couple inquiries come our way just from that. So I think just sharing, and the more tours we give the Entrepreneurial Center and we talk about those resources, the micro business, in addition to the other items that we offer, just creates great conversation and dialogue, and some of that natural word of mouth also. I know there was a lot of advertising done prior to my time at McDevco, and this was a new program. And to Lance's point, you know, there are some items that do make it a little bit tricky to submit, such as we like to wait till there's 5 to submit, or there's certain criteria that maybe make it a little bit more challenging for folks to gather the items that they need. But we're open to any feedback or ideas from the county as to how we can continue to get the word out, but we're just going to keep doing what we're focusing on internally to hopefully spend more of that and get it out to those businesses that need it.
Great, thank you. Supervisor Krause?
Thank you. I don't know if this would be in line with contacting various organizations and groups and so on, but I was wondering if the Chamber of Commerce could be contacted, maybe if they could help get the information out too.
Kim, can you speak?
Good idea.
Yeah, have they been contacted?
I'm not sure about recently before my time, but that is absolutely a great, even if they have, you know, advertised for us in the past, a great idea to reinvigorate that partnership with this particular grant. I like that.
All right, thank you. Are there any other questions? Okay, moving on then to item 4B, status of residential and/or business displacement and relocation assistance activities remaining to be completed. Do you have anything to add?
That was the part I referenced in terms of there not being any negative impacts and that
Okay.
type of thing. We need to specifically just say that.
Okay, thank
Thank
you.
you.
And then item 4C, housing needs identified in the community.
Well, we know that there are housing needs that are identified in the community, and again, this was the opportunity just specifically for those who qualify for this to be able to receive that assistance. So again, that's just acknowledgement of that.
All right, and then item 4D, opportunity for public to provide input and feedback on Cdbg project activities. I don't believe we have any members of the public here, so I'm going to take that the public has no input at this time. So before we close the public hearing, are there any other comments or questions that the board wanted to address? All right then.
Chair Van Cray, we do have a call-in user online.
Okay.
I don't know if they are here to speak to this.
Okay. Go ahead, Supervisor Covelli.
Thank you, Madam Chair. Does this CDBG grant tie in with Section 8 housing?
I'm not entirely sure on that. What I will say is that Marathon County, as I alluded to before, we generally speaking do not get funds directly allocated to us for community development block grant funds because we're not an entitlement community. Thank you, that's the term. Marathon County exercises some activities within the community development block grant, but it does that through a consortium with a number of other counties, and I believe our lead county is Juneau County, but don't hold me to that. I don't know that that answers your question, whether it's specifically Section 8 related. Our programs and there are links on our website relate to benefits for landlords to make certain improvements to properties, and other limited benefits through the Community Development Block Grant. But I can certainly bring that information back. There's a flyer that I believe is just down the hall.
Okay, thank you. So if you're not familiar with Section 8, it's a subsidized housing grant through the federal government, so.
Yes, so the city of Wausau has a housing authority, so the city of Wausau provides that sort of service. This specific block grant, the amount that's allocated for housing is allocated to North Central Community Action Program, and they do the programming for that. In my experience, and you can correct me if I'm wrong, a lot of times it's just assisting with people to pay rent or their mortgage. And in this case, it's proving that you had a difficulty paying due to COVID circumstance, whatever that might be.
Thank you.
All right, seeing that there are no other comments, then we will close the public hearing and move on to item 5, approval of the July 6, 2022 Health and Human Services Committee meeting minutes. Do I have a motion? Motion by Covelli, second by Krause. Are there any comments, discussions, additions? Okay, seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. Item number 6, policy issues for discussion and potential action. We have none today. Item number 7, operational functions required by statute, ordinance, or resolution. Also none today. Brings us to item number 8, educational presentations and committee discussion. That's going to bring us to 8A, continued discussion on potential updates to the 2018-2022 strategic plan. And we have Vice Chair McEwen here and Vice Chair of Health and Human Services, Arstead, who I think are going to facilitate our discussion today.
Thank you, Madam Chair. I'll just start out real quickly. The last time we met to discuss the updates on the strategic plan, you were asked 3 questions prior to that, reference to assisting you with updating the strategic plan. What I hope we can accomplish today is to review the 3 objectives that Health and Human Services is the lead committee for, which is 3.3, 3.7, and 7.2. And I had a couple discussions with Vice Chair Arnstead about the strategic plan, being the Vice Chair of the committee. And in your packet, she updated the information that actually came from Administrator Leonard's most current update of the strategic plan. So I'll let Vice Chair Arnstead take the lead from there, and if you need anything, I'll be more than happy to help. Thank you.
Thank you. So the reason I went through and did what I did was I needed to know what was completed in the strategies and then take a look at the objectives. So I took what Lance had put out there on July 4th about the work draft, and I copied word for word, and when I put it in the packet, I put it strategically in there to facilitate discussion. So you can see starting with objective 3.3, we have completed strategy C and strategy E. And I took a look at the objectives, and if we want to go through those, if we want to change, if we want to continue on with the completed process, that is the decision of our Health and Human Services. So looking at the outcome measure, number 1, by December 31st, 2022, there'll be an increase in high school graduation rates from 92% to 95% in Marathon County. Right now, it's reported that we're at 92.3%. So question is the outcome measure of 95% by the end of 2022, is that reasonable? Or do we re-evaluate that? The second outcome measure is by December 2022, there will be a reduction in the number of out-of-home care days experienced by children in Marathon County. We were at 174 And then in 2021, we were at 193. However, the overall cost of placements did decrease by 316,793 because more children were successfully placed in lower cost and more family-like settings. Placements in relative care and foster care increased, while placements in residential care decreased. And then looking at outcome measure 3, by December 31, 2019, at least one practice will change and be implemented that is aimed at decreasing the number of young adults aged 17 to 21 in Marathon County Jail who were subject to a court order for services as a child. And with that, there are 2 practices that are noted in the top of the working draft under A, the strategy A. So those are listed in number 2 and number 3, where the Marathon County Department of Social Services Youth Justice practice now consistently includes social workers offering services prior to the formal court deposition in efforts to engage youth and families, early to reduce the likelihood of recidivism. Did I say that right? I always say my words wrong. I always look at my husband and go, did I say that right? No, you did not. And deeper involvement in the court system. And then number 3, the Youth Justice Program has contracted with a new provider to evaluate and deliver evidence-based services that can positively impact the rehabilitative process for youth. So looking at objective 3.3, is there anything that you would like to change or add or delete? Do you tell? Okay.
I'll let you go ahead.
Okay. Supervisor Cavelli.
Thank you. Just a question on outcome measure 1. It pretty much stayed at 92%. Is 95% achievable at this time?
Yeah, right. I mean, when this outcome was put into place, I mean, it was put in as kind of a lofty goal, I think, because to move that number is pretty difficult, right? And what I would say about that is this was further a challenge during the pandemic with all the changes in the school as well. So I don't know if it's realistic to keep it at 95 or not. I mean, just personally, I don't know, because there's lots of systems that impact graduation rates. So.
Yeah, if I can add, Vicki did a nice job summing that up. I mean, really, when we put the staff kind of suggested these goals and the county board evaluated them and ultimately approved them, you know, our frame of reference, our perspective was dramatically different than where we are today. We were operating in kind of that reality of, okay, what are the little things that we can do to maybe take us from good to great, which the 92 to 95, that's that stretch goal. Staff's perspective was the things that Vice Chair Arstead was talking about. What are the levers we can pull? We looked at things like, how do we perhaps intervene through our youth justice system and our child welfare system with a different approach to make sure that we focus on kids graduating. That is a relatively small population. When we talk about how many kids we have open to youth justice or child welfare, and I think Mike talked about that before, we're talking about 100 to, you know, at our highest caseloads back in 2016, 2017, it was 200 kids. Likewise, you talk about the programs that the health department operates with getting the mental health consortium, getting counselors into schools, which we know helps kids graduate that are otherwise on the margins. But again, it's still a relatively small body of children that we're trying to get, which I think is good to go from 92 to 95. But as Vicki said, all things were impacted through the pandemic that put strains on children and families that had a lot more to do with whether or not they graduated than the things we were doing. So whether or not that goal continues in the future, I think is a question for the board. But that kind of gives you the background of what our thought process was in terms of how we could, what are the populations we can help to move that percentage.
Supervisor Krause.
With this outcome measure and these goals, I just would like to see it expanded in a different way, such as decreasing absenteeism in the school. From what I have heard is that during COVID, a lot of young children, students, dropped out of school. They just had problems with the computer, internet connections, with attending classes. They just lacked incentive and interest being at home. And I've also heard that a lot of them had to repeat grades just because of the pandemic and not attending school. So there were a lot of, a lot of bad things happening, and I don't see that really reflected in the percentage that we got. Well, that was for graduation. But of course, if you don't attend school, how can you graduate? So unless you get a GED. So I guess I would like to see that expanded not just to graduation, but school attendance increasing. There might be a lot of, what do they call it, when children don't attend school?
Truancy.
Truancy, yes. So I don't know what the situation is here, but truancy might even lead to juvenile delinquency and drug problems and a lot of other things. So I guess I'd like to see that expanded to cover all the students in Marathon County and not just the students graduating. Thank you.
Super. Oh,
I got
Vice
it.
Chair
Thank you.
McEwen.
Thank you very much. And that, I'm glad you looked at that outcome measure. Number one, I think it's hard to get those percentages. I think a goal to improve it, whether it's 1%, 2%, it might be more realistic. But then, if I look at the strategies, are there any strategies in there, in those 6 strategies, that are going to affect that? Or do you need to add something else? Like I said, these strategies were based on, when this strategic plan was adopted in 2018. So, and that's a very good question. I think it needs to be reworded. I don't know, to improve it. We did that on infrastructure with broadband, the 85%. We just, we took that instead of 9,800 people. We'll have internet that you didn't have it in the past. But, like I said, I think you need to look at the strategies up there and the strategies that are in the comp plan. I don't see anything, and I may be reading past it. A lot of it has to do with trauma and informed care, and resilient children, and that all comes with a healthy student going to school. But just a thought, and like I said, I do think it could be reworded.
Can I add one thing?
Go ahead.
Thank you, Vice Chair. With respect to the truancy question, I think that's perhaps I could have done a better job in the update in highlighting that, but if you look to your 2020 annual update document, that is one of the things that staff looked at. Again, what levers can we pull? And we do have in Marathon County, our staff are involved in truancy, I should say. Vicky's staff and the district attorney's office, as well to some extent as corporation counsel's office and our courts. So on page 6 of 37 of the 2020 strategic plan annual update, we reference, the PASS program, and that is an intervention designed to really start to target those children that are in K through 5, kindergarten through 5th grade, that are starting to exhibit those problematic trends of school attendance, and develop an intervention to address that. Vicky's staff also, just in the last year, sat down and really took a comprehensive look with our school districts starting with the city of Wausau, the Wausau School District, to reimagine truancy, because as you referenced, the pandemic influenced that greatly. So we did just have, through our Criminal Justice Coordinating Council, we had a representative, I believe, from the city of Wausau School District that came in and kind of gave an overview from the school's perspective of what that effort has entailed. If you want to make a specific outcome relative to an outcome measure relative to truancy, certainly staff could bring you back a recommendation of what that might look like. But just to kind of let you know, that is one thing we've been trying to do, because that is, when you talk about high school graduation rates, we do engage with children and families where there are struggles of truancy. That is, we're not doing education. That's the school districts. But when kids don't go to school, ultimately they can end up in court, and that is where Vicky's staff and our court staff really do have an impact.
Thank you. Oh. Go ahead.
No worries, thanks. As you guys are talking, I just kind of want to build on some of the last comments, because as I recall when we discussed this previously, the outcomes, they're driven by data points that we obviously have access to, which in our case are limited, but also not necessarily, there's not always a direct correlation between A and B on some of these things, but we'd expect to see some improvement or maybe a decrease depending on what you're talking about. And so to Vice Chair McEwen's point, it might be that if we are interested in seeing what graduation rates are, rather than tie it to a specific goal, kind of just saying, is there an increase? We'd expect to see an increase. And that, then you could say, well, 92.3, it's still an increase, so we'd expect to see it. It's telling us something, but even on the truancy piece, there might be data points there that we can get access to that give us a sense of how we're doing in some of these things, because we're dealing with, like I said, some of it's a little more ambiguous in how they tie together, but also we might not have the best available data to really get at the outcome. But when we all think of an outcome, we think of it being sort of deterministic, like, okay, we did this, so that should be 95% now, but that's just not the case. So when I think about the outcomes, and I think it was Administrator Leonard who mentioned kind of what we'd expect to see, that might be a way to look at all of the outcomes in some regard to say, maybe we're not going to tie it to a particular number, but a trend that we hope to see even in terms of the work that we're doing.
Thank you. Looking at strategy D, develop a framework for building resilient children. We could tie in the intervention for reimagining truancy into that strategy, and the outcome would be healthy students out of that. It's just an idea. Chair.
Thank you. So I don't know if anyone else has this thought, but my thought was, if we have strategies that are completed, we should take them out of our objective. So that was just when I was looking at these things and saw we had completed things, strategies, or if we had reached an outcome measure, obviously looking at that outcome measure to see if we wanted to update it, to a higher level, or remove that outcome measure and look ahead. So that would be my comments for the entire strategic plan. And I do like the idea of changing some of these outcome measures, like leaving outcome measure 1 in with 3.3, but just changing it to say that there will be an increase in high school graduation rates. And then stopping it there.
Supervisor Leahy.
Thank you. I was wondering about if we could tie in the data we will be receiving with the final piece of that grant and providing mental health services within schools. That's going to be something that will be evaluated as part of that grant funding. Is that something we can tie into this particular objective in some way as a fairly obvious thing we should be looking at?
You certainly could. To Deputy Administrator Holman's point, it's much preferred if you find a data measure that you like that we're already collecting, as opposed to creating a new one that will take staff time, energy, and effort to hope to collect. So to your specific question about the Mental Health Consortium, that is available. Their data is available, the last report online. And I don't know, Laura, if you can speak to whether or not they're going to continue to pick at those same data points to report on. But just to build on what Chris was referencing, it is always, I have no doubt you can come up with a better data measure that really you'd like to get. My only request would please give some consideration to whether or not it's one we're already collecting, because collecting data can be a significant undertaking. However, if we're already doing it, it's a lot easier to keep doing that stuff. I don't know if you have anything to add on the consortium, Laura.
With the consortium, we tend to use the Youth Risk Behavior Survey data that's coming out, and it should come out soon. So there are very, very specific data points that are coming out of that. So to Lance's point, in order to have consistency with previous years, it's good to use the same data year after year and the same measures year after year in order to be able to understand whether or not you are actually moving the dial there.
Oh, thank you. Thank you, Madam Vice Chair. So Laura, you said what survey or is that called again? Can you repeat that?
The Youth Risk Behavior Survey, and we like to call it the YRBS because we love acronyms. Yeah, all that data is put in Marathon County's Pulse, so you can access that at any time. We update that periodically when that comes out, so.
So going back to what Chair Van Cray said, do we want to scratch out strategy C and strategy E? Go ahead, Supervisor.
I can't see any point in striking those out unless we have other strategy goals to put in their place. One reason for keeping them in is to see if, was this just a 2-year trend, or can we continue this good result for more than a couple years? Because what happens if it backslides because we're not paying attention to it or putting work and effort and time into it? So I wouldn't say we should delete it unless we have other goals, strategies in its place. And then the point for keeping them in is just to keep a check on that and make sure those good results continue. Thank you.
Go ahead, Lance.
I have the great pleasure of attending all of your standing committee meetings. So this conversation actually took place at Infrastructure about how do we denote in the document and report whether or not a strategy has been deemed by the board or by a standing committee complete. And at Infrastructure, kind of the consensus, the consensus that was arrived at was they would like to capture the idea that that has been complete. They will note completed next to that strategy, and then it's specifically the conversation to what your point is, do you want to replace that with a new strategy? And that's certainly up to you. I will say one other piece of discussion at Infrastructure that you might find germane to your discussions here today. If you look at strategy E, which Vicki just reminded me, the board did, after staff developed the plan at the request of the board did adopt that trauma-informed response plan. But we're really not, the board hasn't directed staff to implement any of the things that are within that plan. So you could, as Infrastructure did, one of the infrastructure goals under one of their objectives, one of the strategies under one of the objectives for Infrastructure was the development of a safety plan. Infrastructure essentially, through their discussion, determined that, you know what, we want to have an outcome measure that calls for staff to move forward at least one recommendation from that safety plan. That was one of the discussions they had. And also to keep an updated safety plan. So they essentially deemed the strategy complete, that a safety plan had been developed. They modified that strategy to say not only did we complete it, but it's now modified that we want to keep it updated, because it has been our experience sometimes that plans, once they get developed and approved, they don't have that constant look, to your point, that we're frequently checking in to make sure they're still relevant. I'll give you one example you'll hear me talk about at the county board in the next couple of months. That is your class compensation plan that you have adopted in 2012. So things need to be updated, which is why we're doing the class compensation study now. So just giving you some options based on the conversation that other committees have had about how to essentially deem something complete, but then modify that strategy and also incorporate strategies into your outcome measures, if you find it helpful or not.
Thank you. And with that discussion at infrastructure, we deemed some of these outcome measures as completed. However, we didn't remove them. We just modified what it states as far as that outcome measure. And as far as the strategic plan or strategic items that are on the top, you could, with their completed, deemed completed, and you get highlighted in red so that, it kind of stands out. Yeah, we didn't want to lose focus on it just because it was completed. We didn't want any other, not to forget about it and just move on. So, yeah, that would be my choice, not to take it out, but that's up to this committee as far as how, they could modify the language like we did with the broadband. In the one outcome measure, it said by 2020, 9,800 more people in Marathon County would have access to high-speed internet. We just changed that to, because that's been met already, that we changed it to 85% of people in Marathon County would have access to high-speed affordable internet. So we modified it, but basically just changed the meaning of it. So. But yeah, and that's what I'm looking for, these strategies. Any changes mark completed. If you want to reword it, that's fine. Same thing with the outcome measures. If you want to modify them, change them, that's up to this committee. And like I said, we had about an hour and a half discussion at infrastructure. We had two objectives. You have 3, and 8.7. Supervisor Robinson's broadband chair. He went through that, and that took us 5 minutes to update. So it was relatively easy. So thank you.
Can I ask a logistics
Sure.
question? Okay, so this item's not on the agenda to make any decision on today, it's just for discussion. So is the thought we're going to have this discussion today, and then do you think it's next month or later on in the year that somebody, I don't know if it's the two of you or you and I, would work towards kind of updating from what we've heard over the last few months and then bringing that as an item that we would make a decision on?
It would be great if you could make a decision and then next month review it with your committee, the drafts that you changed. That's what we're doing this month at infrastructure tomorrow, because last meeting we made all the recommended changes which were put into this into the agenda for infrastructure tomorrow, and there may be some discussion on changing a few things, but we want to adopt, it was just a draft, but we want to adopt those changes and recommend that these changes be brought to the executive committee. Yeah, there's not a deadline. I'm not trying to put pressure on you, but like I said, the sooner you get it done, it would be great. It would help, especially with the budget.
Okay, thank you.
Thank you.
Go ahead, Supervisor Cavalli.
Thank you, Madam Vice Chair. One question I have, and I agree with Michelle, is that if we take those out, and I would like to see them removed, if we're going to want data on, how they're doing, one of my questions is, at the department level, do do you keep KPIs on these items? Like key performance indicators, do you review them monthly? Do you, how do you do that?
At this point, we don't. That is in my work plan. The discussion of data points and how do we determine success has been something that, quite honestly, from the day I started in administration several years ago, has been a discussion point without a firm area of this is how we're defining success, not only at the department level, but at the program level. So, we deliver hundreds of programs across the county, and the idea of KPIs, key performance indicators for each of those programs is something that certainly some departments have. I know Vicki keeps track of data, for example, within our call center, that those KPIs actually drill down to staff performance, so that for some of our programs, we can say, this staff member A, let's look at their key performance indicators for their job, and that flows into their performance evaluation. In terms of programs, that's still an area where we have a lot of opportunity for growth. I don't think Marathon County, from my conversations with my colleagues, is not unique in that regard. You'll see in the budget presentation, I'm asking for the county board to approve a data officer position for that exact reason. But as it relates to some of these programs, we certainly collect a ton of data. And we referenced the mental health consortium before. We have all sorts of data in terms of how many people are accessing that program, what are their reports. One of the data measures there is, how does the individual participant, what impact does it have on them? So right now I'm asking departments, and we're starting to talk about the 3 data pieces that we're looking at is how much did we do, how well did we do it, and is anyone better off as a result? So trying to find what measures, what data do we keep around those 3 ideas for each of the programs. We've started in the justice programs area. I know Chris has met with Laura Yari, our Justice Alternatives Coordinator. But the short answer to your question is we certainly have a lot of room for growth, and we don't have alignment right now between the outcome measures here and the outcome measures that we want departments to achieve, other than what I ask departments to do through their department head appraisals. We'll talk about things, at least in my mind, that align well with the strategic plan, but certainly opportunity area.
Thank you. One of the follow-up to that is I've got a lot of experience with strategic plans in the business sector. When we look at these items in the business sector, and if they're completed, we would remove them for the next round of the strategic plan, but we would keep KPIs on them. So we would keep the data and analyze that data throughout the year or the 2 years that, if this is the cycle for the strategic plan. And then if something, was showing a poor trend, we could bring it back the next round. So that's, my experience in strategic planning.
Thank you.
Jennifer, just want to add one thing, and I appreciate that. This isn't, I'm not suggesting that what I think this committee should do. I want to know from this committee. This is going to be your ideas for the strategic plan. So when I said I would like to see them in there, that doesn't matter. It's what this committee wants as far as the lead, that you're the lead on this objective. So, and I respect that. Like I said, it's just, I have different opinions and you do too, and if I don't get those, like I said, I don't want to make this my strategic plan. It's yours. Thank you.
With all the information that we've received on Objective 3.3, Chair Van Cray, do you think that you and I could sit down and formulate something to discuss next meeting?
Yes, I think unless anyone has anything else
Is
they'd
there-
like to add, and
yes.
you can always email either of us too. In my mind, at least what I see happening is us taking the information from this and probably our last 2 meetings of discussion that we've had and sitting down, putting together an actual draft of the changes we hear you saying, and then bring that back next month as a draft document that we can further refine if needed, or then take a vote on to adopt, I guess, and move on to exec.
Does everybody feel that is reasonable? Okay, should we move on to 3.7? So there was nothing that I noticed was completed in any of the strategies. If I go right straight to the outcome measure, we showed a decrease of 17%, which didn't reach the outcome measure for outcome 1. Let's see here. Outcome 2, 2019, there was 20% in the life report for, might as well read through it. December 31st, 2022, the percentage of the life report community survey respondents who reported not seeing a mental health provider when needed will be less than 15%. It is at 20% as of 2019, and I don't know if we have any more update on that for 2021 or 2020. Does anybody know?
If I may, I believe the last life report that's been released is 2019 to 2021 was the data set.
And that was the 20%. Okay, all right.
I can look to make sure, but I'm actually sending you all an email at the end of the meeting with a link to all the things we've talked about, so I have a list running.
Okay. And then the outcome measure number 3 is by December 31st, 2022. The percentage of high school students in Marathon County who felt sad or hopeless every day for 2 or more weeks in a row that they stopped doing usual activities during the 12 months before the survey will be less than 20%. The report also indicated we're at 26%. So, any additions?
For that outcome measure, Laura, do you know, is that one of the questions from the YRBS? The number of students who felt sad or
that
hopeless.
Yeah, sorry.
Okay. So we should see then an updated data point for that soon.
Right, and that will be updated in, again, the Marathon County Pulse. So if you go to marathoncountypulse.org, you would be able to see that pop up. That is a YRBS data set.
Okay, does anybody have anything they want to discuss about objective 3.7? Donna?
Thank you. I think that this is, these percentages are awful. I would like to see that they come down to 5%, 20%, 26%, 17%. Those are not good. That means 1 out of 5 students is having issues, or even 1 out of 4. So those are high numbers, and I think maybe we could even, we could work on that and try to continue to work on those and try to get those percentages down.
Thank you. Anybody else?
I can,
Okay.
I'll just offer a staff observation, and I offer it from someone who's more intelligent than I am on the topic. I just leaned over and talked to our health officer, Laura Scuderi. This might be an area for perhaps I see it as an area for discussion for the committee, whether or not that measure is really the measure you want to target. It has been my experience and my understanding that the more we talk about the importance of addressing mental health and we remove some of that stigma, people are more likely to report issues and concerns they're having, which is a good thing, that they're answering that question accurately based on their own personal experience. So I understand and appreciate your perspective that people indicating or high school students responding in that way is troubling. But the higher percentage might simply be more indicative of what the experience of students has been historically. I say that not as an accurate statement, but just as a perspective to share, to perhaps stimulate discussion on whether or not that's the right, to Supervisor Covelli's point. Is that the key performance indicator you want to have? Or is that a data point you want to continue to track, which we do through the Youth Risk Behavior Survey and the Pulse data that we want to continue to look at? But is it the touchstone of success, I think, is something I would certainly welcome the committee to discuss.
Supervisor Leahy.
Thank you. Well, on that note, yes, maybe the language could be changed to represent access to those services and even getting more data about why they didn't have access or why they didn't receive that help. There could be a lot of reasons for not seeing a mental health provider, but maybe we need more information on what those reasons are so that we can better formulate a plan, to get that access in place.
So I could speak to that a little bit. When the life report, the 2019 life report that this measure was decided on, it's kind of a different mental health landscape than today. So I think it's worthwhile to think about what is impacting our community today and what does that look like. I know some of the issues that are affecting the mental health community is that we're just not getting counselors in. They're not staying in the community where we just don't have providers. We don't have providers that are willing to see Medicaid, substance use. So I think there's a myriad of different issues that can be addressed here. I believe this was chosen because it was an access measure. It was a determination of how easily can children access, and I just want to mention that was part of the reason why the consortium was beneficial in our community, was that it addressed some of those access issues to ensure that different mental health providers were at different school systems to be immediately available when a child would need them. And so the other piece I just would want to say is that if you want a guide to help you look through some of the things of Marathon County Pulse, we at the health department, we would be more than willing to, we get excited about data. So we'd be happy to walk you through it and show you what is available so that you can make an informed decision about like what speaks to you and what speaks to the current environment.
That would be great. Is that something that you could email to all of us?
We'll send you a link, but if you'd like a guide that can sit next to you and walk you through it, we could also make that happen as well.
Okay.
Yeah, I just wanted to refer, I sent the link to the Pulse, the Life Report, and I think the Community Development Block Grant, or maybe it was the Youth Risk Behavior Survey instead of the Life Report. But to Laura's point, if you want staff to assist you, and again, staff were the ones that brought some of these recommendations forward, and I think the access piece to outcome measure number 2, maybe you believe that still has value. My comments about removing stigma and having more people answer appropriately really was probably more tailored to outcome measure number 3, that individuals self-reported a feeling sad to the extent that they stopped doing usual activities for a period of time. Maybe that doesn't speak to you, and the idea of looking through all the data that we collect and maintain on the Marathon County Pulse website, maybe that is a good next step for you. So you should have that in your email now to be able to access and determine whether or not there's a better measure of success that you want to look at for the rest of this period of the plan.
Supervisor Krause.
Thank you. I have read that because of COVID, a lot of children have become depressed and even suicidal. So these mental health issues affect everything. They affect juvenile delinquency, they affect gangs, drugs, violence. So I think this is a very important topic, very important that we continue to address this in Marathon County because there have been suicides in the schools and there has been violence in the schools too, threats. So I think it's very important that we continue with this. Thank you.
Supervisor Cavelli.
Thank you. As far as strategy F, and Lance, you had sent the email in early July with the updates. I believe it's F1. It says in 2019, North Central Healthcare retained a consultant to conduct a needs assessment and strategic plan to identify service gaps and mechanisms to address them. Given the impact of the pandemic and limited capacity, that effort was paused. Following the selection of the new leadership at Nchc, it is anticipated the needs assessment work will be revisited. So this seems to be, you know, some of the information where maybe that service was retained and maybe they were paid a fee already. Is that going to start up again where we can get that data on the needs?
The last part, I think, is the part that'll be revisited. Whether or not, certainly that work needs to happen. It's actually required by statute that each county, through their community programs department, conducts a needs assessment and develops a plan to address it. I could guess as to the statute, but I want to say it's like 5142 sub 5A something. But the timeline on that, I think, is the real question. And looking back, the interim executive director from North Central is here, Mort McBain. Right now, the focus is, as I put in my memo to all of you, really retaining that permanent executive director, and then starting to really understand, that individual needs to understand kind of where North Central is, and start to develop that plan using the North Central Healthcare Community Services Programs Board. Again, it's a statutory requirement of the counties through their respective programs boards to do that. I don't know how long that'll take. That group that was working on that, I can't remember the. No, not the community. I don't think it was the community health assessment. What was the name of the consultant? Do you remember? I have an email from them, but I can't, off the top of my head, I don't know if they'll continue to use that entity. But they are required to do that every so many years. It's the needs assessment by statute. So I can't tell you when the time frame will be.
So a follow-up to that, you know, without that needs assessment, can we really rely on strategy F at this point?
Looking for a response from me, I think we need to conduct that needs assessment to create the plan, to develop the understanding of what the gaps are and how we're going to address them.
Yeah, so my suggestion for F would be maybe leave it in there with some side notes of re-implementing that plan, you know, to get that going again.
What I hear you saying is one of the questions that Vice Chair McEwen referenced, are there any strategies that need to be prioritized? So I don't know if I'm paraphrasing to say you want that one prioritized.
Yeah, I would like to see that one prioritized, because if we don't identify the gaps in services, then how do we move on with the rest of the plan, right?
The health department is statutorily required to do a community health assessment periodically, and so we are embarking on that process. It does take into account health needs, including mental health and other key pieces of health within our community. And so we work with United Way and a bunch of other different organizations in town to develop this assessment and send it out. So currently we're sending those out, and then that data is collected, aggregated, and put it into a booklet that's called the Life Report. And so I think Lance just sent that out to everyone. And if I'm remembering correctly, and North Central Healthcare might be doing things differently than when I was there, but we did use the community health assessment that the Marathon County Health Department used for all of our requirements. So that might have changed since I left, but that was my last understanding of it.
Thank you.
Is there anything else that anybody would like to change in this objective? Shall we move on to 3.7 then? Or 7.2? We were just on 3.7. 7.2. Okay, it looks like strategy B was completed as well as strategy C. Looking at the outcome measures, by March 1st, 2019, an outcome measure will establish to measure the quality of life for adults in counseling, mental health, or AOD-related treatment programs seen at North Central Healthcare. And according to the working draft strategic plan, get to that here. The anticipate evaluation of all data measures with hiring of new leadership at NCHC in Q3 of 2022. So the quality of life measures has not been implemented at this time. So this is something that, do we want to keep this in here and wait for what the response is after Q3?
Can I just want to make a comment, or I guess a clarification. So this is an outcome measure. We created an outcome measure that says we will create an outcome measure?
Yeah, so I can
Okay.
give you some background on that discussion because I was in the room. The idea being, again, we collect a lot of data about access and how many people go through a program, and North Central was doing that. And Laura in her previous role, and I in my previous role, sitting on what was referred to as the Retained County Authority Committee, we were trying to identify, as Supervisor Covelli referenced before, key performance indicators for programs. And there was this desire to move away from, for example, a measure that would say, that an individual, that your program for substance abuse treatment, that you'd say, hey, it's successful if someone maintains sobriety for 3 years. Well, the discussion that was facilitated led to this belief, maybe we don't want to have sobriety be the measure, but instead a quality of life measure, because we recognize that individuals with substance abuse and mental health issues were going to relapse as it relates to substance abuse, or they could have issues relative to mental health. And success isn't defined solely by, did you have a relapse or not? It's, is your life better? So that was the, layman's explanation of kind of the discussion. And there was a desire at the time to start to implement these quality of life measures across all of the North Central Healthcare programs. That too, that hasn't been able to take place at this point. It hasn't been able to be implemented. And specifically, I do want to qualify that in my report, our hope is that, our expectation is that we would have a permanent executive director in place by the end of Q3 of this year, not that the quality of life measure would be implemented by Q3 of this year. So sorry if just as you were reading that language, Chair Van Crey, it occurred to me, that could be misleading. So the desire is to have, and the hope is to have the executive director in place at that time, not that measure is going to be in place. Did I say that well enough? Laura's given me the thumbs up. I was accurate but not precise.
Thank you. The outcome measure 2, by December 31st, 2022, 3% or less of high school students in Marathon County will report having taken prescription drugs without a doctor's prescription 1 or more times in the past 30 days. And at the report in the outcome measure, it looks like we were at 9% in 2019, compared with 8.4% in 2015 and 11.1% in 2017.
And again, that's for the youth risk behavior survey, so we will get updated data on that too.
Yeah, the reason why there's a different measure down below, the teens who ever use prescription drugs without a prescription, is because the data point changed in later versions of the YRBS. So that is the one that I recommend using going forward, is the teens who ever use prescription drugs without a prescription, as that is the data point that we have now, versus the one that was reported as outcome measure 2.
Okay, thank you. Any questions on that outcome? Supervisor Kraus?
Could you repeat what it is most recently, the percentage?
It was 9%.
Thank you.
Okay, outcome measure number 3. By December 31st, 2022, the rate of overdose deaths among residents in Marathon County will hold steady or decrease. And as far as the work plan update, there is no statistical significance in change from prior years. It's kind of stayed the same. So that's why I wrote same on that outcome measure. Any questions on that? Supervisor Cavelli.
Thank you. I just have a question on 7.2 that might tie in with that. We talk about mitigating the impacts of heroin methamphetamine epidemics in Marathon County. Do we have to now worry about fentanyl?
So fentanyl is a rising issue in our community. Before I speak to that, though, I'd like to get some data together to present about like what it looks like in our community.
Okay. So, if we find that fentanyl is now, on the rise in Marathon County, maybe we want to add that to 7.2 as well.
Supervisor.
Thank you, Vice Chair. And that's a good point. And we don't want to take our eye off of the issue as far as whatever drug it is. Alcohol is not going away. Okay, so that's, but at this time, the methamphetamines and the heroin were an issue in Marathon County. There were a lot of deaths. That doesn't mean this can't change, as far as the wording of it. But like I said, fentanyl is a good example. Alcohol's never gone away. The abuse of alcohol, especially with juveniles. So I don't know, if that helps, but like I said, at that time, these were the two particular drugs that were impacting Marathon County, at that time.
Looking at the strategy B and C as being completed, do we want to continue on with that or pull it? Supervisor Krause.
I was wondering if we could back up a little bit to outcome measure 2. I have a question, and I was wondering if there was someone here who could answer this. It says that high school students were taking prescription drugs without a doctor's prescription 1 or more times in a 1-month period. I'm just wondering, are they selling the drugs to each other like street drugs, selling prescription drugs, or are they getting the prescription drugs from their parents' bathroom cabinet where they keep their prescription drugs, or under the sink or whatever? I'm just wondering, where are they getting these prescription drugs from? And that seems to be a high number still, 9%. Thank you.
Short answer, my understanding is all of the above. That, it's one of the reasons and it's in our previous reports in the 2020 annual update. We have undertaken a pretty wide strategy in terms of breadth of ways to address prescription drugs being in the hands of people that they shouldn't be. And to your point, some of that is diversion. You have people that are going to doctors, malingering certain symptoms to obtain those. You have individuals that have obtained them legally that they no longer have a need for those prescription drugs, so then they are diverted from an appropriate use. If an individual that has them in their medicine cabinet and they're taken by someone else, certainly that has occurred. We have individuals that sell prescription drugs, absolutely, in our justice system, which is, again, why, similar to the comment that Supervisor Cavelli made with, do we need to keep our eyes on the ball of what's emerging, what are we doing with respect to fentanyl? I think it's been my experience, broad strategies are helpful because they adapt well to the changing dynamics of the times. So the way that we're going to intervene with an individual that has a fentanyl addiction or a heroin addiction are relatively similar, and the strategies about ensuring that we have appropriate enforcement, we have appropriate harm reduction, we have appropriate treatment, all those things from a broad, high-level perspective are relatively similar. But to your specific question about how are people getting access to prescription drugs, I hesitate to even guess that I could lay out all the ways to do that. I would say there are really good resources available from the State Council on Alcohol and Other Drug Abuse. If you go to scota.org, I believe it is, there are reports about, specifically for Wisconsin, the Wisconsin State Council on Alcohol and Other Drug Abuse. There are reports that relate to everything from marijuana, heroin, prescription drugs, laying out strategies that local governments can employ to address those issues. And some of those actually were what drove staff in terms of recommendations for strategies. But great website. Again, if you just Google that, Wisconsin State Council, SCOADA, right? Oh, SCAODA, SCAODA. You'd think I should know that. I think I was one of the co-authors of one of those reports. So.
Go ahead.
Thank you. Thank you for speaking to that. I have heard of, and I don't know if this happens in Marion County or not, or what the law enforcement people are doing about it. But I have heard where high schoolers, I don't know if it just have parties or graduation parties, and they take a whole bunch of different prescriptions that they've gathered from home and elsewhere, and they put it into a barrel, some type of container, and mix it with alcohol and different things, and then they drink that, and that's their party fun. And I was just wondering if anybody knows if that goes on in this area in Marion County.
No, I don't think anyone here can speak to that.
Does anybody else have any questions or changes? Vice McEwen.
Thank you, Vice Chair. Just to wrap up what I'm going to just make a comment is, in Chapter 3, there's 28 strategies. Okay, you have 3.3 and 3.7. There's 11 strategies out of those 28. I encourage you to look at the comp plan to see if any of those other strategies could fit into your lead committee's authority. And the same thing with 7.2. There's Chapter 7, there's 12 objectives, and you have 5 of them. So, like I said, I would just encourage you to review those these other strategies that are in there, just to help you if there'd be any other changes or suggestions or additions. So, thank you.
Thank you.
Okay, so then let's move on. Just kind of continuing the conversation, we can touch on a couple more things because we didn't get to A2, which is should any of the strategies under your objectives be prioritized? I think we touched on a couple, but was there anyone that had any others that they think should be prioritized? Okay, if not, then we'll move on to 8A3. Are there any objectives and or strategies from the 2016 comp plan to be added to the strategic plan? And I did have one question for Vice Chair McEwen. Is EED looking at adding anything about childcare or access to childcare?
That would be a great idea. That would be up to this committee.
But is anybody else doing it that we would be either a supporting or like a co-supporting committee? Have they talked about it at any other committee?
I'm going to be meeting with EED tomorrow.
Okay.
And I'm going to mention that too, but I think that could be where there could be a co-lead committee on that, but that would be a great discussion.
Okay.
Thank you.
So then I'm kind of just putting it out there for when we look at an updated draft, that if EED doesn't take the lead on it or wants to be co-leads on it, I think revisiting and taking a look at something related to access to childcare would be a good addition to the strategic plan. Are there any other comments about objectives or strategies from the comp plan to be added? Go ahead, Supervisor Causey.
Yes, I have a question. I have a suggestion to make, and it wouldn't have to be followed through with this year and this plan, but I'd like to see something where there might be some safety and health and mental health issues towards people with disabilities in Marathon County. It could start with children and high school students as well as adults. That was also in the life report as issued as one of the problems or issues in the area's treatment of people with disabilities, discrimination and so on. So I'd like to see that at some time put into a focus for the Health and Human Services Committee. Thank you.
Thank you. Any other comments before we move on from the strategic plan?
Madam Chair, could I just add?
Yeah, go ahead.
First of all, I want to thank the committee for the discussion. This is exactly what I've been looking for. And at executive next Thursday, I don't expect to have if the chair and the vice chair are going to get together, but just what I'm going to report to executive is that we had the discussion, went over the 3 objectives that this committee was the lead committee for, and the chair and the vice chair are going to meet and come up with a draft suggestions for this committee in the future. Is that correct? Okay.
Yeah, I think so.
Okay, thank you very much.
Okay, thank you, Vice Chair McEwen. Okay, let us move on then to, we're going to take an item out of order unless there's any objections from the board. We'll move on to item 8D, update from administrator on budget preparation process. Just flows a little better into the other things we're talking about.
Yes, thank you, Madam Chair. It does, I believe. You guys can give me feedback if you think otherwise. But we recently had a good discussion at HR Finance and Property with one of the new members had posed a couple of questions about the budget, and the conversation was, I thought, helpful. So I'm going to actually have the same kind of high-level overview at every one of the committees in terms of what our process has been historically in terms of developing that annual budget. So as we've said before, and Wisconsin Counties Association was here when they made their presentation, really talking about the board as setting policy, and one of the ways you do that is, of course, subject to state law and administrative code, but you determine the specific programs that Marathon County delivers. Again, we always talk about we exist within the realm of state statute and administrative code, but outside of those things you have to do, the county board says, what do they want staff to do? So what does that mean for staff? Well, our role is really then, again, how to most efficiently and cost effectively deliver those programs. So what that means for me, and I think what it's meant historically in terms of how administration, working with department heads, puts together the budget is absent direction from a standing committee, whether to terminate or reduce an existing program, add an existing program, or expand an existing program, we work to build the budget each year to deliver all the same programs you've delivered in the past, a great many of which, again, are required by statute and administrative code. But we work to do that within the tightening fiscal constraints that exist, particularly the levy limits. So it's a very fair question to say, well, how do you do that when effectively you start every budget with a structural deficit, which is not a great word if you know what that means. But essentially every year we have less money based on inflation and other things to do all the stuff we did the year before. So we use a couple strategies to do that, and I wanted to talk about those real briefly. The first is one that I feel very strongly about, and that's continuous process and quality improvement, as alluded to by Supervisor Cavelli, really trying to understand, what is the most efficient and effective way to deliver those service. We can always do things better, and trying to identify what are the opportunities, what waste exists. There are 8 forms of waste under continuous process improvement. We have a position, historically we had a position in the county until I made her our HR director, that was really focused on that, and we have a program that we call the Ideas Academy that really tries to get that improvement into our program. So increasing efficiency is one strategy. The second is technology, which really dovetails nicely with increasing efficiency. We told all of you about that with our implementation of Workday, our new enterprise resource planning tool. Right now we have a whole ton of spreadsheets that take a lot of time, energy, and effort to put in place and maintain and update. So technology is important. And then the last one that I want to talk a little bit more in depth about is model changes. So the county board sets the programs. Staff are trusted to determine how do we deliver those programs. And I'll give you an example of what I mean by how a model change is a little bit more nuanced than a program. So historically, if you go back and read the last probably 7 or 8 budgets that that are available on the website, you'll see a lot of discussion about Start Right. And really what that is that's a home visiting program, a nurse home visiting program. That's the program that the county board has said, we want nurse home visiting for at-risk families and children. The way that we've delivered that program is through the Start Right model. And if you want to go back and you can read all those prior budgets, we tell you what Start Right is, broken down into a series of specific modules within that overall model. But the program is that nurse home visiting. Well, staff's job is to constantly, or as often as we can, go out and evaluate, are there better models out there to do that in terms of effectiveness, as also in terms of cost effective. And if you watch the Board of Health presentation yesterday, very proud to report that we're going to make one of those model changes in 2023, particularly as it relates to Start Right. We're going to move from Start Right to what is called the Nurse Family Partnership, which is a model. If you peruse the NACO website, or if you listen to Wisconsin Counties Association, it's been actually discussed on each of those relatively recently. So we've used Start Right for a long time. In 2020, staff partnered with the University Year Program, the partnership that you've heard about, to try to get at a couple of things that the board has highlighted, really in keeping with the comments made by Supervisor Cavelli, trying to understand what's the return on investment for this home visiting program, the model that we've used, which is Start Right. And we did that. They undertook an evaluation, and really what it highlighted was there were some shortcomings with respect to that Start Right model in terms of access to longitudinal data that would really aid us in determining return on investment. So staff took that, specifically Laura and her team took that and said, okay, we see these limitations with Start Right. We understand the board is really focused on return on investment and data for key performance indicators. is there something out there that is a better model to utilize? And credit to Laura and her staff, they went out and they found this nurse-family partnership, which is, again, referenced on the NACO website, the National Association of Counties. It's used in over 40 states. There are several counties in the state of Wisconsin that have used it. And we dove into that. Laura and her team dove into that. And we're going to make that model change in 2023. And the great thing is it's going to give us that access to that opportunity to build our own longitudinal data set. We'll have better return on investment information because of the wide breadth of use across not only the state of Wisconsin, but also the entire country. Because Start Right was kind of, by the end, it was really a homegrown system that we've tweaked enough times that no one else quite did it like us, which makes data collection really difficult because you have to do it all yourself. This way, if we have fidelity to this program, we'll have a lot better access to data. So we're going to make that move in 2023. And the great news on top of all that information about access to data and availability nationally and ability to build our own, it's financially very advantageous for us to do that. So encourage people to go look at the Board of Health presentation. I know the chair and vice chair are on that board and heard that yesterday, so I won't go into the details, but it's projected to save us in 2023 about $370,000 to make that model change. So staff are doing that. I go back to what I said before. Absent a standing committee, and you have your areas of jurisdiction in this committee, absent you providing myself, Chris, and the department heads the direction that you want to terminate or reduce an existing program, add a new program, or expand an existing program, we're going to do our model work to the greatest extent we can. We can't examine every model we use for the over 600 programs and services we deliver every year, but we do try to cycle through and hit the high points and Start Right, I think, is one. You're going to hear about a model change probably at Public Safety, but also probably hear Vicki and her team, as well as our Sheriff's Office, have been doing a lot of work around our shelter program. So we'll bring that model change that we envision, if we envision making a change, to you. But really, my request of all of the standing committees is if there's something we're doing that you want us to stop in terms of a program or service, to the extent we can, because again, we're mandated to provide a lot of things by state and administrative code, you need to provide that direction or you're going to get a budget that delivers a lot of the same stuff, all of the same stuff to the extent I can, within those fiscal constraints. So that was the kind of starting with 8D because it sets a good stage to move on to 8B and then 8C, but I certainly will take any questions if anyone has them relative to that real brief budget prep overview. We've really just started the budget preparation piece from the staff side in earnest. Very recently, staff are diving into what are their current payroll budgets because the government service delivery is a people business. The vast majority of our costs that we have control over are people. It's compensation. So we're doing that. I sent out my guiding memo to all the department heads earlier this week. So that's where we're at. And please, to the extent you want to, over your next meeting, at your next meeting in September, at the very least, or at the very latest in October, if you have things you want us to make fundamental changes to, looking for that guidance from each of the standing committees.
Thank you. Can you just share with the committee the timeline for that? For those who are new, maybe don't know kind of how the process goes through finance and then to the board.
Sure. And that should be in the packet for HR Finance at your next meeting. It's actually been in the HR Finance and Property Committee packet a couple of times recently. And I'm going to get the dates wrong, so I'm not going to give dates, but I'll talk about process. By statute, the administrator in an administrator-led county is charged with developing the budget. I will develop a budget that I just told you kind of the process I'll use, and I will add one other thing to that. It will be a balanced budget. That is, revenues will match expenses. That is required by state statute. I will do that. So I will present that budget to the HR, Finance, and Property Committee based on the guidance, again, that I get from all the standing committees relative to any new programs or terminations of existing programs. And I will deliver that to HR Finance. HR Finance and Property then has control of that budget for a period of time where they can make amendments. Once they adopt that, they receive my budget, and once they adopt that budget, it is frozen, for lack of a better term, for publication and the conducting of a public hearing before it's ultimately received by the county board, and the board has discussion about what priorities or modifications it would like to change within that budget that was proposed first by the administrator and then taken by HR, Finance, and Property. But the specific dates are going to be in that, they have been in the HR, Finance, and Property Committee
It's
packet.
probably like October, sometime in October for HR Finance, and then we as the full board vote on it in November.
I believe the date is October 3rd that it's received. The HR Finance then will consider it and perhaps adopt it by the 10th. Your public hearing date, Kim probably knows the public hearing date off the top of her head.
I think that's,
But
Sounds good.
we can make sure that we get that. I'll send that out to you later today with the specific dates from the HR, Finance, and Property Committee packet.
Thank you. Are there any other questions for the administrator about the budget process before we move on? All right, then, we will move back to item 8B, update on Department of Children and Families Family Keys Program.
So I'll be very brief, and if you have any questions, Vicki can be here, but we really don't have a whole ton of information for you. But just to be very transparent with you, after the conversation and action by the board, the Department of Children and Families did reach out to Marathon County and express, again, an interest to work to address some of the concerns that the board had in their discussion, the concerns that DCF heard. I want to start with, this is not unusual. We work with, I said before, where counties are creatures of the state. We have a lot of departments that work very closely and really work at the direction of state agencies. Vicki and Social Services take a lot of direction from DCF, Department of Children and Families. Laura and her staff take a lot of direction from the Department of Health Services. Similarly, you have from DHS. Similarly, Mort just stepped out, but North Central largely gets a lot of direction from that agency. Our corrections division within the sheriff's office works with, no surprise, the Department of Corrections in terms of how they need to run their operations. So it's not at all unusual that DCF would reach out to Vicki and her team. But like I said, they remain interested in trying to address some of those concerns that were expressed. So we don't have a firm understanding of what any potential revisions to that program might look like. But the initial conversations have centered on a couple of key things, and I just wanted to make you aware of those. The congregate living aspect of the board, DCF heard, and we certainly heard that was a concern, so we're going to be discussing with them what might it look like to move to a model that relies more on single-family housing. Another concern that was referenced was risks to the county associated with signing leases, essentially acting as a landlord, or the idea that was referenced of public housing, that the county would be engaged in public housing. So our thought process right now is to evaluate, is there an opportunity to move to a model more consistent with our longstanding process that, again, is something we do pursuant to court order and administrative code and best practice through social services to work to provide rental assistance to families to get them to be in a stable position where their children can be returned. And then lastly, trying to address the concern about ensuring that individuals within the program would move quickly from the grant-supported housing into a more sustainable housing that they would be responsible for. So we're going to have conversations with DCF hopefully about what might that look like. And right now our initial contemplation is it might be an opportunity for a stronger role for one of the partners you heard about already today, and that is North Central Community Action Program. But again, just wanted to bring this to your attention. I don't have any firm details. That was just a initial conversation that DCF followed up with us on, and I wanted to be very transparent to this committee and the full board about that interest. So that's all I have right now. I would imagine if we do have those details, we'd bring that back at a future meeting, and I'd be seeking direction very consistent with what I just expressed relative to the budget. If that's something you want developed into the budget, I'd be looking for direction from this committee on doing that. But right now, I don't have any additional details from Department of Children and Families or from our staff perspective of what those opportunities might be.
Great, thank you. Vicki, was there anything you wanted to add? Okay, are there any questions for the administrator? Go ahead, Donna Krause. Supervisor Krause.
Thank you. I remember one of the board supervisors mentioning that this is a big government, that government is expanding way beyond what it should be. And I'm just wondering, my response to that would be, well, our population is increasing. You know, what was our population 50 years ago to what it is today? And in order for our government to serve its citizens, to continue serving its citizens well, it will have to expand and have new programs to handle the new population, the increase in our population. So I'm just not frightened that our government is too big and is becoming unwieldy, or they're just gobbling up too much of our tax money. So I just have those objections and concerns to that comment. Thank you.
Thank you for your comments. Any other comments or questions? All right, moving on then to item 8C, report from Marathon County NCHC Executive Committee members on program cessation recommendations from NCHC board, including for development of the 2023 budget.
This is going to be a tag team between Mort
Thank
and
you.
myself. So I'll kick us off. And as always, I like to ground us with a little reference to your board rules and state statutes. It's my opportunity to have a little bit of foot in the legal realm. So under your rules, you have an executive committee. Your rules and your tri-county agreement that the board has ratified with Lincoln and Langlade counties that forms North Central, there is a mechanism where you have representatives on what is now called the Executive Committee of the North Central Community Services Programs Board. I am one of those two representatives, the other being Chairperson Kurt Gibbs. And Chair Gibbs not only serves as the chair of the Marathon County Board, but he serves as the chair of the North Central Community Services Programs Board and the chair of the Executive Committee as well. But I'll give you a little bit of an update on some of the discussions that we've had at the Executive Committee, and then Mort can go through any questions you might have about the recommendations that came from the North Central Community Services Programs Board. But at a very high level, it's very similar to the discussion I just had about the preparation of the budget. The North Central Community Services Programs Board, by statute, is asked to assist the director, Mort, in developing a budget. And again, it's no surprise, and Chair Gibbs has referenced this at several meetings, certainly certainly at HR, Finance, and Property, but also at the full board. But some of the challenges, the financial challenges that exist at North Central Healthcare, many of which can have at least some direct line drawn to the pandemic. But nevertheless, that Community Services Programs Board has been tasked with identifying, are there programs that are currently delivered by North Central that moving forward North Central shouldn't provide? And those are tough discussions because all of the programs and services that are delivered at North Central, just like all the programs and services that the county delivers, impact people, and they are good programs that if financial constraints didn't exist, we would all welcome the opportunity to deliver, but that is not reality, and we all have financial constraints. So recently, the North Central Community Services Programs Board had a couple of discussions about two programs that they recommended not be included within the 2023 budget that is being prepared by the Executive Director of North Central Healthcare. And the way that they did that is very similar to the discussion that you might choose to have at your committee. They started to look at what programs and services are not mandated and therefore are discretionary, and then tried to assess whether or not there were other resources in the community to deliver those programs and what would be the implications of closing those programs. And we started with, those discussions started with staff looking at financial performance, because we need to look at opportunities to provide financial support to the ongoing operations at North Central Healthcare. If we're delivering a non-mandated service, but it's generating a great deal of revenue, probably not something we're really looking at stopping all that soon, unless it takes us away from our core in such a way that is more to the detriment of the organization. But nevertheless, we started with a couple of programs, and I believe Mort's handed out the two of them. The first is Pre-Vocational Services Program, and there's an explanation of what that is. And it's a program that historically, and I'll try to truncate my comments here, historically the counties did have a role in delivering this service. But as statutes changed, that obligation, as I understand it now, really rests with the managed care organizations, the regional managed care organizations within the state of Wisconsin. North Central delivers the service really as a vendor to those managed care organizations. So when you look at the program evaluation document for pre-vocational services, I'll lead with the important detail up front. It's certainly a valuable program. That said, it is not one of those programs that is generating a great deal of revenue over expenses. Instead, it's quite the opposite. So if you flip to the last page, you'll see that there is, should we stop the delivery of that program based on the current utilization and our expenses, we would be projecting to save approximately $187,000 when you account for the fact that right now we allocate a fair number of indirect costs to that program. There would be $320,000, you'll see on that last program, that last page, excuse me, $320,000 in gross savings, but that's really not an accurate picture because again, we will need to reallocate those overhead expenses. And Mort can answer any questions on that program. But the second program that I wanted to just bring to your attention was the Community Corner Clubhouse as well. And you'll have documentation on that program. That program does receive a direct levy allocation from Marathon County. Again, very important program, but it is not mandated and it does not operate to the financial benefit of North Central Healthcare or Marathon County when you look at the discrete finances of each. Instead, if you factor in that levy allocation and the operating losses for the program, the projection in 2022 is that it will end the year with approximately $210,000 if you don't factor in the levy allocation. So effectively, it is that $210,000 that the North Central would benefit in terms of financial performance if we were to get out of delivering that service. Now, again, all these services are important to the constituencies that they do serve, the clients that they do serve. I think there's an opportunity, and North Central staff have done a great job putting together this material, indicating what that next step in terms of identifying similar programs within the community to provide a transition for those individuals that are served through those programs. But ultimately, again, the direction from the North Central Healthcare Community Services Programs Board to the Executive Director to this point has been to not include those programs in the development of the 2023 budget. The Executive Committee has looked at those recommendations as well, but I wanted to bring them to this committee because, again, this is the committee to which the Executive Committee representatives report. So I certainly can take any questions, but I want to kick it over to Mort if he has anything to add.
Great job, Lance. Lance just basically took care of my presentation. That's wonderful. Did a good job. I want to take you back quite a few years when I was sitting in Lance's seat in the big corner office. And we had a really tough budget year. coming up, kind of like this year, as a matter of fact. And we talked with the executive committee and the finance committee, and we said, you know, this is going to be a very hard budget year. We're losing revenue. The state is not living up to their obligations, and we're going to have to make some reductions and cuts. And so we had a very good discussion over several months. How do you do that? You know, it's easy to start programs in the county if you've got the money. Trying to stop a program or defund it is very difficult. If you've got anybody in that program at all, it's really a challenge to say, well, we just can't do this anymore. Anyway, we had that discussion with that board many years ago, and we, out of that discussion, we developed something called the Program Evaluation Team, or PET project. And we looked at every program that the county offered, and we evaluated it, and we ranked it on a numerical ranking system. But when we got to the budget, it was a lot easier for the board to look at the rankings of every program and do it objectively and say, okay, these programs scored, let's say, 750 points out of 1,000 points. So that would be a high-ranked program. Let's say a program scored only 200 points. And we had a very good set of objective criteria. We took every program through it with the department head, and then we all ranked it, and then we calculated what is the score for that program. And end result, as you can imagine, is the lowest ranked programs were cut or were eliminated or transferred to some other entity to manage them. And that's how we got through with the budget. And you have to do that with a county budget. If you're in a tough budget year, there's only one way you can balance the budget. Well, there's a couple of ways. You can either increase your revenues, which is increasingly harder in these days, or you can reduce expenses. And most likely what happens is you have a combination of reducing expenses and increasing your revenues. So that's where we're at with this year's budget. And so our executive committee at North Central, we said, okay, we're going to have to reduce some programming this year. We cannot afford, we're already at a $2 million deficit, probably $4 million by year's end. We have to cut something unless we can identify $2 million of new revenue, which we can't. So we started again something we'll just call the program evaluation. And that's myself and the management team over there sitting down, going through each program that we offer. And the first page on your little packet is a list of all the programs that we offer. It's a very narrow list. There's many sub-programs under some of those programs. For example, at the bottom, it talks about outpatient services ×3. What that means is that each of the 3 counties offers a program in that area. And the ones at the bottom are what we would call core programs or mandated programs, most of them under 5142. Those are the programs that by state statute we must provide. The county actually must provide these programs. So the county contracts with North Central to provide these programs. The ones at the top are not mandated, they're not covered in Chapter 5142, and they're not what we consider a core program of North Central. There are programs that have been funded to some extent by the county in the past, but over the years, some of these programs, we have seen reduced funding for some of these programs, and we've been running deficits in many of these programs. And we're at the point now where we have to say to the county, okay, if we're going to continue to run these programs, we cannot run them at a deficit because that's taken away from the core programs that we have to provide. So what are the options? The only options are that we can come to the county, to you, and say, okay, if you want to continue these programs, you have to fully fund this. Because we can't subsidize it from North Central's other mandated programs. That's not fair to the other programs. The other option is that we reduce those programs or eliminate them. And that's where we get to the recommendations. So today we're just talking about the two that Lance briefly covered, and I'll talk briefly about the pre-vocational program. That was a program that's been around for many years. They have clients in that program. We have staff in that program, and we are proposing to transition that program to Northern Valley because they could actually run this program with the funds that they receive, the revenues that we receive. It is almost kind of like a self-sustaining program, but not quite. So the county would be getting out of subsidizing that program. We would turn it over to Northern Valley, and we would pick up the employees in that program and transition them into North Central's employee workforce. So no one will lose their jobs. And as far as the clients, they will be transitioned over to Northern Valley. They're under contract to provide for some of these clients already. This would take the remainder of the clients and offer them the opportunity to pursue their vocational training and their vocational work at North Central, or excuse me, Northern Valley Workshop. So that program has no real loss in terms of the clients losing their program, and the employees will be picked up by North Central because we have many vacancies right there, as you know, in the current environment. It's hard to find employees, and so we will bring all those employees over to North Central, so to minimize the impact on the employees and the clients. And then we get to the other one, which Lance mentioned, which is a little harder, and that's the Community Corner Clubhouse. And that's a good program, and we've evaluated that, but it also does not generate any revenue. And we only get a partial reimbursement from the county to operate that program. And there's not a lot of clients in that program. So it's a rather expensive program to operate in terms of the cost per client. So we've looked at that and estimated that if we had to continue that program, well, the county would have to make that decision. You would have to agree to fully fund that program if we were to continue it. And that's really a decision that you have to make. We can run it for you, but we cannot run it without fully funding it. So that's where we're at with Corner Clubs. We're meeting with them tomorrow morning, and the same thing applies there as far as the employees go. There are 3 full-time employees at Community Corner. We will transition those employees over to North Central. We will offer them positions that are equal to or better in terms of their salary than they have now. So no one will lose their job. The clientele will have there are other programs offered by North Central that are not exactly like Corner Clubhouse, but they offer the same kind of mental health services and counseling for some of these clients if they would need that. So there are not any equivalent programs in the community that we can transition them into, but we do have some services at North Central that they can access if they need them. And that would be on an individual basis. So that's where we're at with Corner Clubhouse. And as Lance mentioned, we've already taken this to our executive committee and our board, and they said, if you can't get the funding to run this, then we need to close these programs and transition them, because we simply cannot put a budget together that has a deficit like next year, like we did this year, and we're still feeling the effects of that deficit budget this year, and next year's going to be harder. So with that, I'll stop and ask if there are any questions about.
Thank you. Go ahead, Supervisor Cavelli.
Thank you for that presentation. Question on the Marathon County Pre-Vocational Services, one thing came to mind was if you transition to Northern Valley will have to hire new employees for this?
Yes.
Okay, and if you're having problems hiring employees, how are they gonna hire employees?
Right. To some extent, they may be able to continue on the programs with lesser staff. In fact, we're hoping that they'll be a little more efficient than we are, but there will be a bit of a stress on there trying to get all the employees. And we're certainly willing to help them out. If they absolutely cannot get certain employees, we would let them hire these employees over.
Okay,
And we maybe will help them out that way if we have to.
okay, thank you. And then the Community Corner Clubhouse, you're talking about, in here I see that since Nchc owns and operates the building, the actual building, I'm not sure where the clubhouse is, where it's located.
It's right on the campus.
Is it on campus? Okay. So then that was one of my questions is, do we sell the building or do we keep it on campus to use for something else? But that, now that it's a little clearer for me, so,
Thank you.
thank you.
No, it's Ave. It's on the west side.
Clubhouse is actually located on 3rd Avenue, so just across the river. Yes, by Greeby's, yeah.
Not
So-
on campus?
No, not on the campus.
So the follow-up question to that, if it's not on campus, do we look at selling the building or
Most likely, most
or
likely.
will you try to partner up with somebody else to run the program and take over the program and fund the program?
The problem with a clubhouse is there's no revenue attached to that. It's just a kind of a social organization for those who are recovering from AODA issues, mental health issues. More of a social thing, but we have to have it staffed. And since there's not adequate revenue, it's just, how do we run this program and pay for these employees when we haven't, not enough revenues to do it?
Yeah, I totally agree with you. And then, it looks like you serve anywhere from 10 to 20 members and 10 to 12 meals per day. So, and this goes along with, are there possibly some private entities in the community that would look at taking this over, possibly that could do the same work, without, putting these people out with no place to go?
Right. We haven't identified any specific organization in the community that would be willing or able to take this over. It's basically running at a loss. Nice program, and it's great for those people that are in it. But in terms of having to have 3 full-time employees to run this program, it's just not that viable for us to do that, to continue to do that, unless we were being paid, or reimbursed to run it.
Just building on what Mort's referencing, I think there are, it's always tough to say, hey, is there another entity that'll do it the exact same way? And I think Mort's answer is accurate. Or precise. I'll go with very precise. The answer probably is no. Are there other entities that do adjacent things, like Mort referenced, that individuals can select from those options to get something very similar? I think the answer is certainly yes. There's Adaptive Communities, is a local nonprofit that does adjacent work with similar populations that, should the individuals that are currently served through Clubhouse desire to do so, that transition is available to them. Like Mort said, there's also a lot of programs at North Central that provide services for individuals with those challenges already, and those programs would be available. And that's specifically to your point about meals. I think everyone has probably seen the significant amount of construction going on just down the street here with the Community Partners Campus that is going to have a whole host of nonprofit organizations located there. There's going to be a lot of opportunities for people to kind of self-select from those resources, the programs and services that, are they the same? No, but it's very similar. And I think, again, the thought process, at least from myself and other, the discussion we had at the full board and then also at the executive committee, are there other entities that, to your specific question, can pick up the mantle and kind of help in enough ways that we don't anticipate significant issues? Our belief is yes. Are people going to be impacted by this? Absolutely. These are programs that people have been relying upon in terms of forming their daily habits and their daily lives for a great many years.
Okay, thank you. I think and that kind of, alleviates my fears of, these people that are used to this program and knowing that there are other programs out there that they can go to or that we can steer them in that direction at least, without just saying, hey, we're closing the doors.
Right.
And instead of giving them the support that, hey, here are the other programs that you can use and utilize without a disruption, right? So.
Right. In fact, just add one more thing to that. Lance talked about the community partners concept. It's just down the street. We are partnering with that CPC. We're going to be providing some mental health counseling there. So if some of these clients were in that condition where they needed to have some counseling or therapy or whatever, we are already operating or planning to operate in that building. So.
Okay, are there any other questions? I have one follow-up. Are these the only two programs you're looking at cutting, or are these just the two you brought today?
These are the two that I brought today.
Okay.
There may be others, but they may not be cut or transitioned. I'll give you an example. Riverview Terrace, we've already taken care of that issue. We will no longer administer that subsidized apartment building. And that was at request of the city of Wausau that said they wanted to change the model. We were contracting to the city of Wausau to manage Riverview Terrace. They've changed the model for that apartment complex. They no longer want to have it as a well, I forget the term, but they're changing their model. It's going to be more of just an assisted living facility without things like meal services and other things that we were providing. So they came to us and said, we want to take that program over and change it. So we said, okay, fine, you can have the contract back, and we're kind of glad to be out of it. It's one last thing that we have to do. Again, it's not a mandated program. We were doing it for the city, but now they're going to run it themselves and change it the way they want it. The other one that Lincoln Industries, that's Lincoln County's Pre-Voc program. And we've already negotiated with them. We're going to change that program also, get out of running it. And some of those clientele are going to come here to Northern Valley as well. We're also going to pick up the employees from that program if they want to come over to North Central. So that is already underway. That is being negotiated with Lincoln County, with their board, for us to get out of running that program. And that's as far as we've gotten. The first 4 on the list are in process. There may be 1 or 2 more, but maybe not. It depends how far we get into the budget. We try to preserve these programs as best we can, but there's sometimes just a point where you say, like Start Right, that was a great program. In fact, I started that probably 20, 30 years ago, and it's been great. But things evolve, things change, and programs need to evolve as well. And you can't just cling on to a program and say, we're always going to have this, and you just have to continually evaluate the effectiveness of your programs. And so I commend you for looking at that program and restructuring it to meet current needs. Things do change.
See, so I owe you money for that. Thanks, Mort. But no, just to build on one thing. I said this before, so this is the part where the policymakers are, and your policymakers are up to the county board, but starting at your program committees, and that's North Central Healthcare, North Central Community Service Program Board, bringing these recommendations forward. The stuff we're not talking about that North Central is also doing to address the financial issues are the same things that I brought up before with the model change for Start Right. North Central is doing a lot of stuff on the efficiency side, examining how can we change our staffing models, how can we address each of the programs and services we deliver to do it more effectively and efficiently. A big one is maximizing revenues. We just, at the North Central Healthcare Board, approved some fee increases, which it's been long overdue for fee increases. So it's not just the, hey, let's identify some programs that are not mandated that we perhaps don't need to deliver any longer. There's a lot of other things going on, and I just wanted to mention that, and I think North Central is doing a great job identifying those. But to this point, those are the two programs that have been evaluated by staff at North Central, the North Central Community Services Programs Board, and the Executive Committee. So absent some direction from the county board in terms of the budget that I'm working on right now to fund those things, that's the direction we're gonna go.
Thank you. Go ahead, Supervisor
Yes,
Crosby.
I have a question. I didn't see where it said anything about meals in here. Maybe I missed this for the community corner clubhouse?
About what?
That, how many meals are served or that meals are
It's
served?
on page 2, number 6, at the very bottom, says meals served per day.
Oh, okay. All right. Well, I was wondering, do they have their own kitchen and they prepare meals there, or are there certain businesses that donate the meals? Do you know what the situation is there?
Yes, they have their own kitchen, and they prepare the meals there. That's one of the daily living activities that staff work with participants to do that.
Okay, thank you.
Supervisor Covelli.
Thank you, Madam Chair. Do we have, if we're looking at cutting these two programs, do we take action today or no?
Well, I would say the action would be by exception. If you feel strongly that we should continue these programs, then your action should be to agree to fully fund these programs. And we are asking, if you would do that and take that approach, we would want some sort of commitment for about 5 years that you're going to commit to keep these things going. Because we can't come back here every year and, beg for money, can you please keep us going? So that's the decision that you would have to make proactively for us to keep these programs with the agreement that you'll fully fund them and you'll guarantee that you'll fund them for 5 years at least, so we're not back and forward every year with the budget. Lacking that, and if you don't take any action proactively like that, then what we're saying is that we will move forward with the direction from our board and our executive committee that these programs will not be funded in the 2023 budget. I mean, we're saying that. This is our intent. And you can stop that or change that by saying, okay, no, we want to keep these programs going. So.
Just to build on that, we put it on for education today to just, again, make everyone aware. You guys can have time to think about it. Again, I'll send you the budget timeline. But as Mort said, the plan moving forward is absent some allocation from Marathon County to continue these programs. The plan is to move forward with that transition.
So like we talked about earlier, if we did decide or had interest as a committee to further continue these programs, then we would want to have it on the agenda as an actionable item where we could vote and say, yes, we are continuing Community Corner Clubhouse and we want it to be funded in the budget. So then Lance can go ahead
And if that's your desire, sorry, I apologize, Madam
go
Chair.
ahead.
Please tell me what you want to cut.
Where the money's coming from.
Yes. Because as referenced in each of the documents, they each come with a cost. And please don't utilize the money that we were able to project to save in 2023 with the model change to the Nurse Family Partnership, because that's already spoken for with
Go ahead,
inflation.
Supervisor Krause.
Yes, I have a question for Mort McBain. Do these four, I don't know if you call them businesses or services, do they know they're possibly on the chopping block?
Short answer, yes. In fact, I'm meeting tomorrow with the Clubhouse employees, and we'll be talking about what's coming with the budget. We're also meeting with the Pre-Voc staff and the clients. We put that one off. They didn't want to meet right away. But they already know it's coming, but they're going to meet with us on, I think it's the 15th, to talk about how we transition everyone over. And we do have, I should mention, in order to make this work, we have put together a transition plan for each of these programs. We first developed a template because the committee asked, well, how are you going to do this? You know, when do you talk to the employees? When do you talk to the staff? How do you move the staff over? How do you what are you going to offer the staff in terms of comparable positions? So we have a plan for each of these programs that we share with, first of all, the committee, and then with the clients and the staff of the program. So that it's very clear what we're doing here and how we're going to make this work. So there's a kind of a seamless transition. If you're an employee, you're not going to be out of work for 6 weeks or 8 weeks, or you're going to be transitioned over. So there's seamless moving over to the North Central High or to Northern Valley, whatever one you decide. So that's all planned out ahead to make this work properly.
Any other questions? All right, thank you, Mort. Moving on to item number 8, next meeting time, location, announcements, and agenda items. 8A, committee members are asked to bring ideas for future discussion. You can send those to me. And again, if you have programs that you are interested in adding or removing from the budget, send those to me as well so we can get them on the agenda properly. And then item 8B, next scheduled meeting, Wednesday, August 31st, 2022 at 3 p.m. Okay. Oh, go ahead.
Those of you looking at the strategic plan, if you can get anything that you want us to address in pulling together, I would say probably within a week, right?
Yeah, I would agree. I'm not able to meet until after next week, so I would say by the 12th or the 15th, and we can take a look at.
So if you have anything you want to add, delete, or say, please send it to Chair Finley. No, I said that wrong.
That's okay. All right, number 9, I'll take a motion to adjourn. Motion by Cavelli, second by Arstead. All those in favor say aye. Aye. Opposed? All right, we are adjourned. Thank you. You can bind us. I don't know.